Namaskar. Today we have with us in the studio Dr. MarkJ.Reger, a doyen in the field of cardiology. He is at present President-elect of American Heart Association. He has come to India for the first time. We welcome you, sir, to our studio. Sir, how do you feel after coming here?
Well, it's been a wonderful experience so far. This is a beautiful venue to hold a clinical and scientific meeting, particularly in the area of prevention of cardiovascular diseases. How
it is different from other? You must have gone to many places. You must have attended many conferences. And how it is different this year?
Well, I have had the opportunity to attend quite a few scientific conferences in my career. This conference is distinct in that it is integrating clinical care, medical care, that is science, with the spiritual approach to patient care.
So what do you think is the sort of problem today in the cardiovascular health? Where we are lacking? India, what is the problem today?
The problem is not health, it's disease.
Yes.
We have far too much cardiovascular disease globally. There are 17 million deaths per year, at least there were in 2008, and that's projected to rise to 23 million deaths a year from cardiovascular disease by 2030. So it is a very real and urgent problem that we need to address. And probably the most effective way we can address the high rate of cardiovascular death is to treat the issues, the risk factors that cause cardiovascular disease. What does that include? Well, it includes high blood pressure. It includes cigarette smoking.
Yes.
It includes diabetes. And integrated into all of that is obesity.
Right.
Obesity has become a very, very real problem, which itself leads to diabetes as well as high blood pressure.
What do you think is the cause? Why the hypertension, diabetes, obesity, and addictions like smoking, alcoholism, they're increasing? Because these all are conventional risk factors for coronary artery disease.
Well,
so what is the cause? Why? How it is?
There's probably a number of causes that contribute to the overall prevalence of these risk factors in society throughout the world and here in India as well. We have greater opportunity to consume foods that are rich in calories.
Yes.
Sugar-free, sugar-loaded beverages, for example, are the foods we buy are often loaded with salt. We're not choosing the right foods to eat. And in doing so, we'll consume much too much salt. And in terms of cigarette smoking, probably one of the biggest problems is having our children beginning smoking because they're seeing others do it, or because there are marketing campaigns directed to children, and they're starting much too early and continuing the habit throughout their life.
What do you think how the mental stress is responsible? Can the mental stress is one of the factors which is leading to all this?
I think mental stress and these risk factors in cardiovascular disease may go hand in hand. Certainly those people who are encumbered by diseases, those who have diabetes, those who have high blood pressure, those who actually have cardiovascular disease, they're recognizing there's a problem. I'm sure they feel stressed because of that. And those people who have stressful lifestyles are more likely to take the easy road, right? They're more likely to go to a place where they'll get a food that is rich in sugar or high in salt, or more likely to turn to the cigarette and smoke as though that's the answer for stress. So it is a two-way street, and I do think that within all of this there is an integration of stress with risk factors and with cardiovascular disease.
So this was about 50 years back, you rightly said, but 50 years back the situation was totally different. It was a disease of the rich people. But today it is a disease. This disease is present in poor, farmers, bus conductors, and almost every age. It has come to the young people. More than 50% cases are below 50 years of age in India. Right. So it's affecting the young working population the most. And also, it is same hypertension, diabetes is coming at an earlier age. in India. What do you think is the cause here?
So it's very true that India is suffering from premature cardiovascular disease. And again, I think there's multiple causes. And I wouldn't say it's just a disease of rich people, nor that it was a disease of rich
Previously
people.
it was, but today
well,
it is.
Poor people throughout the world smoke just as much as rich people do. That's not a disease that's confined to the privileged.
That's right.
Obesity in the past may have been more confined to those who were able to afford and eat food, whereas the poor people were the ones laboring and having physical activity each day and not having the benefit. But today, it's just the opposite. I can certainly say in the United States, it's the poor people who live in areas where they cannot get food that is as healthy as in the areas that serve them. They're the ones who are in places where they get what we call fast food, foods that are low, that are high in salt or rich in sugar. And that may certainly be contributing here in India as well.
So like this in this World Congress, we are discussing different issues about hypertension, diabetes, and other issues like coronary artery disease. And this center, Global Hospital and Research Center, in collaboration with DRDO and many tertiary centers all over the country, has conducted a trial, Mount Abu Open Heart Trial. And it was published in 2011. It's a 16-year-long study. And you must have read this study. This has come in the world's top 20. So now it's first ranked study in the world. So you must have gone through the study. What are your impressions about this study?
To be frank with you, I have not had the opportunity to read this study.
Okay.
And I'm not familiar with it. So it would not be appropriate for me to comment on it until I've had the opportunity to do so.
Yeah. So what do you think this type of trials in which we are conducting, like say this Mount Abu Open Heart Trial and Abu Healthy Heart Trial, we are conducting these two trials in our country. And how we have shown in that the modification of lifestyle. We have a three-dimensional healthcare approach in which we address the spiritual sort of problem, the mental problem, and the physical problem. All the three levels are addressed at the same time. We call it three-dimensional healthcare or three-dimensional heart care. What do you think is the scope of such approaches? It's a total approach.
I'd love to see your science. I'd like to see what you're measuring, and I'd love to see your outcomes.
Right.
And then trying to determine which of your interventions are most effective.
Right.
Because recall, everything that you do here that you'd like to extend to the public at large has to be something that can be easily applied.
Right.
And today, even though we are making inroads in many places in terms of decreasing the amount of tobacco that's being used, in terms of getting people to exercise, in terms of making people aware of the difficulties to their health with high salt and high sugar, we have a long, long way to go. And I would encourage you to collect careful data, analyze your data carefully, and learn as much as you can to see which of the interventions that you're using are those that are most effective and can be applied to the public at large.
Then you can go through the study, but what we have seen in this study is that the RajaYoga meditation, by practicing RajaYoga meditation, that improves the willpower, that the person develops willpower to adhere to a healthy lifestyle, that is following a healthy, balanced, going for exercise daily. He has that will to be well. He says he can say no to tobacco or alcohol, and he has good sleep. So that is how the person develops good healthy habits, behavioral risk factors are finished, and all these so-called psychosocial risk factors are finished. And they have played the great role in this study. So I think you must go through the study and then...
Well, certainly.
We'd like to have your...
I'd be happy to, but healthy diet?
Yeah.
Excellent.
Yeah. Healthy
Smoking
exercise.
Cessation?
Yes.
Excellent. Exercise? Excellent. These are lifestyle modifications that all of us support and which have been shown to modify risk factors, and by doing such, reduce the risk of cardiovascular disease.
What we have seen that meditation basically improves the willpower to be well. So that is what we have seen in our study. So I think such studies we need to multiply in our India also, and maybe in other centers in the world as well. So I just like to have your impressions of this place, coming to this place as a whole, and what is the message to the world?
This is a beautiful venue, as I've said. And the people I've met here are wonderful people who have a very positive look on life, and I would encourage that. And I think a positive look on life and being aware of those issues that will improve your health are extremely important. And I would encourage the people who come here, as well as the people watching this program, to take those actions really to address lifestyle and how they can do those things that will reduce their risk.
Thank you so much.
Okay.